2021 is going to be a bright year. I think we are going to see, at least in the US and probably much of Western Europe, vaccines become widely available, certainly by May or June. And if things go well, maybe even a month or two before then. Not much before then, because it's going to be hard to produce that many vaccine doses. So I'm kind of looking at May or June as a time period where 60, 70% of the population may be vaccinated. And that, of course, means that the pandemic will be under much, much better control by then, and things will really start turning around. Obviously, there's still quite a ways to go between now and then, and there's a lot of hard work to get us there.
Right. I mean, you talk about hard work. I think a lot of it has to do with the distribution as well as the production of the vaccine at scale because of the kind of orders that have been put in place. And so how effectively will that process work?
Yeah, this is the big question. You know, we need billions of doses of the vaccine for the whole world. And there are now two companies that seem to have vaccines that have cleared the hurdle, and those are Moderna and Pfizer. Chinese are developing their own vaccines. Again, they have not finished phase 3 trials, as are the Russians. We'll have to see how those go. But the big bet has been on the AstraZeneca vaccine. That's the one we expected to make billions of doses for the world. And so far, we haven't seen enough data on whether that vaccine is going to end up being effective or not. So there's a lot of work to do to make 6 billion, get enough doses to vaccinate 6 billion people. That's going to take all of 2021 and probably into 2022 before much of the world is able to get vaccinated.
Ashish, talk to us about the logistics of starting the vaccination going, because the first group of people, as I understand it, will be the frontline workers, the healthcare workers. What are some of the logistics involved getting everyone in the front line vaccinated by a certain time period?
Yeah, there are two sets of issues. I mean, first is you've got to convince people that vaccines are safe and effective. And while most healthcare workers, I think, are open to hearing this, there's still some skepticism, even among healthcare workers. And we have to do a good job of explaining to people that the science here is very, very good and it's going to work. But then the logistics for healthcare workers is maybe among the easiest, because they can probably get vaccinated at work. And most workplaces are going to require that people get vaccinated as a condition of working. So that will make it easy. Similar for other first responders like police and firefighters and ambulance. It's when you get into the broader general public that the logistics get harder. And of course, convincing people that they need to be vaccinated gets harder. So much of the hard work will kick in after the first round of people get vaccinated.